Dr. Poornima, consultant gynecologist working in Ankura Hospitals for Women and Children, Bodikal branch. Today I will be speaking about menstrual cycle. So, what is menstrual cycle? Menstrual cycle is the periodic bleeding that occurs through the genital tract in a woman who has attained menarche. So, menarche is the first period that a woman has in her lifetime. So, this normal cycle. So, first we need to be aware of how a normal cycle is, so that we can differentiate between a normal cycle and then any abnormality in our menstrual cycles. So, normal cycle has 4 characteristics. One is the 4 characteristic features of menstrual cycle are: first is the duration, that is any cycle which normally menstrual cycle occurs every 28 days, but the duration can vary. So any cycle between 28 days to 35 days is considered normal. Then the next feature of menstrual cycle is the volume of bleeding. So normally a woman will bleed around 80 ml per cycle. So any bleeding which is more than 80 ml per cycle is considered heavy menstrual bleeding. Then the third characteristic feature is the duration of bleeding. So the duration of bleeding is normally between 5 to 7 days per cycle. So if the woman is bleeding for more than 7 days, that is considered a prolonged or long period. Then the fourth characteristic feature is the regularity. So how regular her periods are depends on the difference in the days between each cycle. So a difference of more than 7 to 9 days per cycle is considered irregular cycle. So less than 7 days of difference in the cycle is taken as a regular period. So this is how we will know. So any woman who is having her periods every 28 to 35 days, that is the normal cycle, and she should not bleed more than 80 ml, and the duration should not be for more than 5 to 7 days. This is how a normal menstrual cycle is seen in most of the women. Thank you.